think the thing that can set us apart is that certainly with some of the direct to the patient treatments.
When you say direct to patient, you mean sort of mail order?
Sort of mail order orthodontics, yeah. So with some, there could be a situation where no X-rays are taken, and if somebody has a gum problem which hasn't been picked up, then the speed of destruction of bone is actually very, very quick. So they could literally lose their teeth, or perhaps even have something missed like a cancer or something like that could be serious and picked up earlier. So there are quite a few concerns that I have with that approach. If somebody does come to see us, then it's not just one treatment. There are a vast array of them. But even within those treatments, there are kind of variations. So we might say, well, we can do something specific. We can use this brace, but we can use it in a very different and innovative way. It's more difficult to do that when you just take an impression, send it away, and get a brace back that you're just going to say, well, we'll just go through the stages with this from the start to the end. It's too formulaic in my mind. You actually need to be able to kind of roll with the punches a bit, and I often say to my patients that the treatment is it's always one of changing horizons. There will be things that happen that you didn't expect. So if your teeth are very crowded, for example, before we start the treatment, as we move your teeth around, suddenly you kind of see that bit of wear on one of the teeth that you hadn't noticed before, or a little gap might open up somewhere just between the necks of the teeth. Because if the tooth is tapered and crossed over as you straighten them, you might get a little triangle there appear. Again, with a formulaic approach, you don't know whether that's going to happen, and so if it does, again, what do you do next? Because you can reduce those triangles down, and if the patient wants that, then why not try for them? But if you've had an appliance which has been made to go from A to B, then you've kind of got to go back and say, well, that's not worked, so we've got to do something else. And that something else might not exist for somebody who just has one appliance to use.
Do you see many patients who come to you after having orthodontic treatment in the past that hasn't worked?
Yes, and it's becoming more common actually. And sometimes it is just tidying things up. There are a few situations where the problem that's arisen has actually made it impossible to do anything else. So that's sometimes the risk that one can take with trying a treatment out that doesn't work. Fortunately, in many cases, there are things that we can do, but it's a shame if somebody gets to a situation where there's no longer a possibility of doing further treatment.